The latest now on a nationwide outbreak of a parasitic illness with important context here at home. Health officials tracking nearly 7,000 cases of cyclosporiasis across 34 states, the largest clusters in the Midwest, where investigators are looking into possible links to fresh lettuce, pre-packed salad greens, some restaurant items, though no specific brands have been recalled. Here in Washington state, leaders say the situation is very different. While 27 cases have been reported since May 1st, officials emphasize they are not connected to the outbreak back east. Most are, in fact, linked to international travel. Joining us to break down what we should know here and how concerned we should be is Dr. Vin Gupta, public health doctor, medical analyst for NBC News and MS Now. Thanks for joining us, Dr. Gupta.
Good evening, Joy. It's great to be here.
Okay, first, what should we understand about this outbreak and how concerned should we be?
Well, Joyce, you did a really great job in the tee-up in explaining that this is a parasitic GI illness that we see in the summer times. This is not unusual to see cases of cyclosporiasis, which is a parasite that infects the intestinal tract of human beings sometime during the summer. We just don't see it to this degree. The case rates are 10x, in some cases like in the Midwest, 20x higher than normal, but we do see it because this parasite thrives in warmer temperatures. People eat more produce in the summer months, so we're used to seeing it, just not at this frequency.
So our state health officials say that the cases here are tied to international travel, not the outbreak in the Midwest, which is so severe. Why does that matter?
Well, because in any outbreak of an infectious disease, we want to see are events connected? Is this one outbreak? It's just spreading across state lines? Or in this case, if this is because of international cases, that's helpful because, sort of harkening back to pandemic days, even though this is not a pandemic, we want to understand connectivity of cases. What is the etiology? Because we want to ultimately find the source. If the source is in the Midwest, that then factors into what we have to do from an action standpoint. If it's sporadic cases from international travel, that's a little easier to deal with and a little less worrisome also, Joyce, because then we're not worried about exponential growth.
And so explain to us how this spreads then. We have the 27 cases here, but it's not, as you said, as rampant as we've seen in the Midwest. So explain to us, how does this parasitic virus spread?
Absolutely. So it's a parasite that lives basically, early forms of it can exist on produce like lettuce, fruits, even contaminated water, Joyce. And you can ingest, say, a piece of lettuce that might have this parasite that's microscopic on it, and you may not actually get sick for up to a week. It can be anywhere from 2 days, the incubation period, to 2 weeks. And so that's also a complicated factor. People sometimes don't even remember what they ate because it can be such a long period of time from eating infected food to actually getting sick. But those are usually the risk factors. And I'll just say for our viewers here, if you're going to eat produce, first of all, there's been some advice online I've seen, Joyce, to say just stay away from fresh produce. I think that's overly broad and not necessary. Just remember to wash any fresh fruits and vegetables for at least 30 seconds underneath that sink. Make sure that they are cleaned. If you are in a higher risk group, immunocompromised, medically fragile, pregnant, just older, over 65, I do encourage my patients and anybody that's watching, make sure that you cook leafy vegetables for at least the next few weeks while we're getting a handle on this outbreak and what's causing it.
And then I do want to talk about the symptoms because they can be severe. At what point should you seek medical treatment versus riding it out at home?
Yeah, I'm glad you mentioned that. If you are in one of those high-risk groups, if you've been having GI symptoms, watery diarrhea for at least, say, 48 to 72 hours and it's not going away, you're not able to keep down fluids, and again, you're in that high-risk cohort, older, pregnant, on an immunocompromising medication, or you have an immunocompromising disease like end-stage renal kidney disease and you're getting dialysis, that's when I want to make sure you're speaking to your medical provider because early detection, early treatment is critical, Joyce, for that group. And we have good antibiotics that can easily treat cyclospora, much easier to do so earlier rather than later.
And in 10 to 15 seconds, the bottom line we should take away from this is what?
that this is not uncommon, but just the magnitude of this outbreak is very uncommon, and we think related to the CDC cuts to the foodborne disease surveillance teams back in 2025. These policy decisions are having real-time impacts.
Dr. Vin Gupta, we so appreciate your time and always your insight. Thank you.
Thank you.